Hello, everyone. So the next part of the chapter is medications for diarrhea. So here, and well, the definition of diarrhea is stools with excessive volume, fluid, or increase in frequency of defecation. So patients, they have different ways of expressing diarrhea. I have diarrhea because my stools were very watery, or I think I have diarrhea because I'm going a lot to defecate. I'm going a lot to poop to bathroom. Same thing like diarrhea is not a specific disease, it's a symptom of many diseases. So we cannot treat diarrhea by itself. We need to make sure that we know what is causing the diarrhea. And what we have as causes, we have infection, maldigestion, inflammation of the GI system, or functional disorders of the bowel. One thing that we know is that if we don't treat diarrhea properly, uh, patients gonna go into a dehydration state with electrolyte imbalance, talking sodium and potassium. So like I was telling you, diarrhea is not a disease, it's a symptom, so we need to do the proper diagnosis, the proper lab studies in order to understand why that patient has diarrhea. Also, while we get the diagnosis, we need to make sure that we replace all the fluids and electrolytes that lost on this process. We need to provide medications for the relief of cramping at the abdominal pain and make sure that this patient is able to make more form stools. So what medications do we have to treat diarrhea? The best ones are the ones that come from opioids. And we have a list here. Difenoxylate, difenoxin, loperamide, paregoric, and opioid tincture. So if you remember when we saw opioids as a painkiller, when we saw opioids for cough suppressant, mentioned the adverse effect was constipation. So based on that, someone said, hey, let's design an opioid that is not addictive, but has that constipation effect. And that's where loperamide, being the most common, is the one that is used. Loperamide is Imodium, difenoxylate, that's Lomotil. So both of them are opioids, and they have those properties of constipation. Just that they are not used for to treat pain, moderate to severe, or suppressant, and they have no addiction properties. And again, even though it says here that high doses can elicit typical morphine-like subject responses, uh, they're very rare, and basically any opioid from this list has no potential for abuse. Now, regarding diarrhea, we have to make sure that we understand the disease. It can be by infection. Usually it's caused by bacteria or parasite. Parasite here is the group is protozoa. This type of parasite is very tiny, is the size of a cell, so it's not visible with a naked eye. We need a microscope. So those are the types of infectious diarrhea that we can see. And they're self-limited. It's only a couple of days. And basically they require no treatment. Just make sure that the patient is hydrated. Unless the patient has a more severe infection like Salmonella, Shigella, Campylobacter, Clostridium, all of them bacteria, then this one we need to provide antibiotics. All of them are gram-negative bacteria, and because of that, we need to provide proper antibiotics so we can stop the diarrhea. If not, the infection can be fatal. Regarding bacteria, that one of the most common ones that we hear a lot is E. coli, and we have heard a lot of stories where they have to throw away lettuce in big quantities because they were contaminated with E. coli. Regarding E. coli, usually is self-limiting, but again, if the patient has something in their medical background, like diabetes, something like that, then it can be fatal. The most common medications to treat gram-negative bacteria in the stomach is ciprofloxacin and norfloxacin. So you can see they have the floxacin ending. Medications to treat gram-negative bacteria in the stomach. Okay, let's go back over here. Now, regarding non-specific anti-diarrheals, if we see that there's no uh, uh, infection behind it, then we can proceed more calmly, and we can provide bismuth subsalicylate, which is Pepto-Bismol. It can stop the diarrhea. We just need to let the patient know that the stools are gonna become black. That way, when they Google it, not gonna get scared that oh my God, I'm eating the GI system. Uh, Also, we can use bulk forming agents. We mentioned this in constipation problems. We have uh, metamucil, and it's a type of fiber, goes, and yeah, it's gonna pull water, but the thing is, it's gonna make a bolus. It's not just gonna be liquid. So this can control the diarrhea in a couple of days, and it goes away. And anticholinergics. So here, anticholinergics, they block the cholinergic stimulation. And we mentioned anticholinergics, they dry the body out. So yeah, patient has diarrhea, give an anticholinergic, but we have to be aware that now this patient is gonna have dry mouth, dry eyes, and so on. So again, this part was is very simple, it's very straightforward. So I'll see you in the next part very soon.